To further weigh in, let's welcome board-certified OBGYN, Dr. Greg Marchand. Doctor, you know, we just heard Dr. Contessessa talk about the associations between pregnant women taking Tylenol and then their children having autism. What do you make of those associations? And, you know, also the maker of Tylenol's defense saying that using Tylenol during pregnancy has been proven safe and effective.
Well, there's been a lot of research on the relationship between acetaminophen in pregnancy and autism over the years. The truth is that we really don't have any high-quality evidence, so there's really no definitive answer either way. When I say high-quality evidence, I'm talking about something like a randomized control trial or a meta-analysis of several randomized controlled trials. Those are the types of things that really convince doctors that they have to change their practice. All we've got is really observational studies about this, studies that were looking at things that happened in the past, maybe examining charts in the past, or sending out questionnaires to patients. So that the jury is still out. The best evidence so far, still very weak evidence, but shows there may be a connection. Now, as far as the announcement from the maker of Tylenol, I'm sorry, go ahead.
No, finish up your comment. Yeah. Sorry.
Yes, as far as that statement from the maker of Tylenol, they really don't put a lot of weight in that, especially the language. You can see they were kind of definitive, kind of calling it, so to speak, that it's the determined science or, the definitively defined science that we've come to a conclusion. There is no consensus on this. There's very few consensuses in medicine. This is how we do medical research as we search to find the answer. So it's really important that everyone understands they should talk to their individual doctor, and it should be up to your individual doctor and you to decide if the risks outweigh the benefits.
Doctor, what do you recommend the women coming into your practice? Do you recommend them using Tylenol, and if so, how much? And Dr. Contessessa said it really depends on the dosing and duration of how long you're on this over-the-counter drug.
Well, I have to give the caveat that I am also very excited to see what's going to be announced at 4 p.m. And he may be announcing, he did use the buzzword gold standard, so it's a possibility he's announcing that someone is releasing, meaning someone is publishing this week, a randomized control trial on this topic. But barring that right now, I cautiously do recommend Tylenol if needed during pregnancy. Of course, we don't use it for no reason, but there is really no other agent that works well for pain and for fever after 30 weeks. Aspirin, ibuprofen, naproxen, all those have to be stopped around 30 weeks because of the challenges they pose to the unborn baby's cardiovascular system. So as of right now, I'm still recommending up to 650 milligrams every 6 hours as needed for pain. But like everyone else, I'm going to be watching closely and seeing if there's some new research, perhaps a randomized control trial that's been published that we're going to find out about today.
In your practice, has there been any other links? That we're seeing rates of autism spike over the decades. Is there any one cause or association that you've seen amongst the women that you treat?
Unfortunately not, and a lot of that is because it's just a tough thing to study. First of all, it's very tough to design an ethical study about mothers that are going to take something that may harm their baby and then have another group where you're not going to give that medication. So it is tough to study. And then in addition, autism really isn't diagnosed till 2 to 5 years of age. And that to the fact that not everyone has the same definition of autism spectrum disorders. For example, Asperger's, like Elon Musk has. Does that count? Does that not count? So this is a very difficult thing to study. I personally, and in my research, I'm director of a major research institute, I haven't found any connection thus far, and I can only point to the latest research on acetaminophen, which shows that there may be a small connection, of course, talking about a fraction of a percentage more in mothers that use acetaminophen in pregnancy.
All right, Dr. Greg Marchand, thank you so much for joining me today.
Thanks for having me.